Welcome back to Get Well Acadiana with Dr. Kevin. I'm the Senior Vice President for the Bryant Wellness Institutes. Thanks for joining us today. We're Louisiana's most advanced functional medicine institutes, and I'm here with my co-host, Brandon Como. Brandon, how's it going today?
Oh, it's going really well, man. Happy to get the weekend started.
Me too. I'm excited about the show. By the way, for those of y'all that aren't familiar with Brandon, he's like the hardest working man in radio. He's all over the place. He's on Moon's show every day, and then he has his own show at 4 called Offsides, which actually that's my favorite show on KPEL. Now, don't tell Moon I said that, but it's my favorite show now. Well, next to this show, of course.
Yeah.
And so we're switching gears a little bit on the show today. It's time for us to take a little bit different take on some body complaints that people are suffering with, and so we're going to start a new series of shows that are more of a musculoskeletal nature. Now, what does that even mean? Musculoskeletal obviously means any body complaint that you have of the muscles and skeleton and soft tissue. That's anything that you have that's causing you pain or discomfort or lack of range of motion or stiffness or, pain on bending, any of that stuff, that's called musculoskeletal complaints. And I'm also changing my show format a little bit. Normally when I start a series of shows, like the first show will be all about philosophy, and then we'll get more into the details later on in previous shows. Well, the problem with that is that if somebody only catches the first show, they email me and say, hey, that was all philosophy. Like, what do I do about all this? And so we're going to actually give you both in today's show. And when we talk about body complaints, we're talking about joint pain, arthritis, disc problems, muscle pain, even complex problems like fibromyalgia and multiple sclerosis, even these really, really complex psoriatic arthritis, all of that falls under the category of musculoskeletal type problems. And people struggle with these every single day. And Brandon, the big problem that I see is people go through their life and start suffering with musculoskeletal type complaints. They do something that we call adaptation. So what adaptation means that when I'm discussing their body complaints with the patient and I'll say, well, listen, what are some of your enjoyments that you do in life? They go, I used to dance, but I'm too old now. I don't do that anymore. My spouse and I used to go dancing, but I'm too old for that now. What do you mean? You're sick. You're in their 60s. That's not old. People explain their problems away as they're being old still, and they're very, very young. So, or they'll say, well, I can't go fish anymore, or I don't lift the grandkids anymore. I don't play with them outside. I can't do that anymore. Well, pretty soon you've adapted yourself out of everything that's enjoyable about life. You're basically just existing. You're just kind of sitting there. And so the truth is that you need to look for solutions to solve these problems, and the earlier we get to it, the better. And this is true for so many people today. Literally thousands of people out there are suffering every single day, and many of them have just given up looking for a solution. Maybe they had a doctor somewhere tell them, well, your knee pain's from arthritis and it's gone and there's nothing you can do about it. Or so they just give up. Or so many people out there feel like they've tried everything with their pain and they have gotten no relief. Like they've been everywhere. Like they've tried physical therapy, they've tried shots, they've tried everything they can do for their problem, and nothing they've found helped them. So they just kind of give up. And others feel like as long as I cover it up with medicine, then I'm fine. So they can say, well, yeah, my knee bothers a bit. I take my 4 Advil every day and I'm good. Or, I take my pain medicine every day. I'm okay. It's not a problem. I have to get to work. All of these misconceptions lead us to be in really serious shape way, way earlier than we should in life. So on today's show, we're going to dispel some of the myths about chronic body complaints, about chronic pain, and new solutions and new things you can do out there to solve these musculoskeletal type complaints. So if you have any kind of joint pain, if you have disc problems, if you have arthritis, anything like that, even complex stuff like fibromyalgia, you're going to want to stay tuned for today's show, because we have some really new, advanced, cutting-edge technology where we're able to help problems even after people feel like they've tried everything, or maybe you have been everywhere and haven't found solutions. Some of these new technologies still might be able to help you. We've been on the cutting edge of treating these complex body solutions for quite some time, and we're really starting to figure this thing out. And so the problem that I see, though, is that by putting these problems off, they have a tendency to get worse and worse over time. And I ask patients, people are funny, especially men. I'll say, well, when did this start? And they'll say, well, like 12 years ago. Well, why are you just coming in now? Well, I can't stand in the front of my boat and fish anymore. So it finally got bad enough I can't sit in a deer stand. So now I need your help. If you would have just came in 12 years ago, this problem would have been so much easier to solve. Now we have so much work to do to try to get it better. Not that we can't fix it, but it makes my job a lot harder. Now, the question is, where will you be? What does your body look like? What does your joint function look like over the next 10 or 15 years? Will you be doing all your activities, or will you be stuck in the house using a walker or a cane? Will you be having joint replacement before it's time? Or would you rather put a great program in place now to avoid all of that and to stay healthy and functional? And now here's the problem with something just as simple as knee pain. We talk a lot about knee pain. We have a great knee and foot program. But when you talk about knee pain, that can affect every other part of your health, because if that knee keeps you from walking, it keeps you from going on your walk, now that knee has caused a heart problem, a lung problem, a weight problem. So musculoskeletal complaints are more serious than just, I can't walk. If they prevent you from doing things, not only are you losing the enjoyment of life, but they could also prevent you from staying active, which then you're going to turn around and get weight gain and heart disease and diabetes and lots of other problems. So today we're going to be discussing some amazing new technological advances in non-drug, non-surgical treatment for musculoskeletal pain. Now, the cool thing about this is our program, what we've done is we've taken the 4 most effective body solutions for these type of complaints, and we've put them together as one comprehensive program. So this is neat because each one of them by itself might help you a little bit. And, sometimes patients say that, oh, I tried A, B, and C, and it helped me a little bit, but it didn't fully fix it. And then I went and tried this over here, and, that helped a little bit, but it didn't fully fix it. Well, what if we do 4 things and each one of them helps you 25%? We're 100% of the way better. So it's this coupling effect of our program that makes our program for pain and body complaints so effective. So what we've done is we've taken the 4 most effective current high-tech solutions, these technological advances. There's 4 different things that we found for body complaints that can help almost all of these sort of musculoskeletal type complaints, and we've put them in one program that's part of a comprehensive strategy. So today I'm going to dive into all of that on the program, and you're going to see after today's show that we've made huge strides in these non-drug, non-surgical relief for these musculoskeletal type complaints, and even really complicated conditions. There's more patients than ever before have been diagnosed with things like fibromyalgia and osteoarthritis and multiple sclerosis and, these psoriatic arthritis, these things that people in their mind generally think, oh, once I have this, there's just really no good solutions for it. Even these complicated conditions are showing tremendous promise with this new program that we've put together. But here's one big secret to the program. The sooner we get to it, the better you will do. The problem is, people put their complaints off and cover up their symptoms with, like I was saying, Advil or Tylenol or something stronger for years. And speaking of something stronger, I wanted to take just a second to call attention to all this opioid problem that we're seeing. And Brandon, I know that you being in the news business, you're hearing more and more about this. Mm-hmm. I mean, all of this started generally with people taking pain medication. And they might get it for a shoulder injury. Yeah. They unfortunately become addicted to it. And then pretty soon they can't get that anymore, so they're turning to some of these other things. Or, maybe it's a young person who got in grandma's medicine cabinet, who had pain medicine that she, kept for a shoulder injury.
Right.
Guys, we need to really push these drug-free, surgery-free solutions as much as we possibly can. Body complaints are a degenerative condition, meaning that as it gets worse over time, these problems don't just sort of all of a sudden get better. And, listen, Brandon, as men, we're the worst. We think if we can limp from our chair to our truck and limp into work and then limp back to our truck and back to our chair, then we're good.
Yeah.
I'm good. I don't need the doctor.
It's all about being tough.
Yeah. We were raised that way, like toughing it out. And, being tough is okay to tell an 8-year-old that falls and scrapes their knee.
Yeah.
But as an adult, that can kill you.
Right.
Ignoring some of these problems. Listen, 40% of the time, the first sign of heart disease is a fatal heart attack. So you have to pay attention to your body and make sure that you're taking care of yourself. Listen, one of the saddest things I do every day is when I have to walk into a room and sit down knee to knee with a patient and tell them that they're no longer a candidate for my type of treatment. They waited too long, and now they have to go do some of these radical treatments. When I have to look a patient in the eye and tell them that, it's really an unfortunate thing. So I always encourage everybody listening, to get your problems addressed and stop putting these things off. This is your health that we're talking about. And as far as joint problems go, those things only last so long. Sometimes people think, well, if this gets bad enough, I'll just go have this joint replaced. Joint replacements only last for so long. If you have your knee replaced at 65, by the time you get 80, that joint might be worn out and it's time to have it replaced again. And so what do? You don't want to have one of those radical surgeries at 80 years old. So, and especially at 90. So if we can postpone that knee surgery till you're 75, now it lasts till you're 90 or 95. So that's a lot better outcome. That's a lot better outcome for you. And I probably hear at least 2 or 3 times a week, and this is one of my pet peeves whenever it comes to knee problems, is patients will say, well, my doctor said this was bone on bone. Listen, I hear that probably 2 or 3 times a week. And honestly, I'll tell you all this, in the 20 years I've been practicing, and out of the 10,000 patients that I've evaluated in these 20 years, I've never seen one actual bone on bone joint. They say that all the time.
Yeah.
It sounds scary. It's a visual in the patient's head. I have bone on bone. Guys, I've never seen one before. There's always some cartilage there. We can get to do better, and we can try to get that cartilage to function better and get that cartilage to start to work again. So, this sort of, I've always had kind of one of my pet peeves in practices when, a patient comes in and says, well, my knee is bone on bone. That sounds good, but I've never seen one. I'm not saying it doesn't happen. I'm just saying I've never seen one. So when we get back from break, we're going to dive into all this. And this is Get Well Acadiana. I'm Dr. Kevin. I'm the Senior Vice President for the Bryant Wellness Institutes. And listen, if you're interested in talking to me about your physical body complaints, maybe you've just wondered if these treatments might be able to help you, and you're not sure if this is something that you want to do or not, I'll gladly call you when I get back to work Monday and discuss, how my program might be able to help you. And I can probably tell you over the phone if you sound like that you would be a candidate for my program. And if I don't think that you are, I won't waste your time. I only accept patients that I truly feel I can help. So if you want to have me call you back on Monday, you can call my office and leave your name and number on my machine. It's 837-7174, 837-7174. And right after the break, we're going to talk about how some of these amazing advanced solutions just might work for whatever your musculoskeletal problem is. So stay tuned right after this break. Welcome back to Get Well Acadiana with Dr. Kevin. I'm the Senior Vice President of the Bryant Wellness Institutes, and we're Louisiana's most advanced functional medicine institutes. And on this week's show, we've switched gears a little bit. We're discussing musculoskeletal pain, and that means pain anywhere in your body. And literally, I mean pain from muscles, skeletons, discs, soft tissue, joints, cartilage, all of that. And we're discussing solutions for today's worst joint problems as well, like arthritis and, even complex things like fibromyalgia and disc ruptures and multiple sclerosis, all of that still counts. And if this is you, I want you to know that natural solutions do exist that you've probably never heard of, some technological advances that we've made in this field. You know, you don't have to live with these type of conditions. And so we've made tremendous advancements in this field of drug-free solutions for these musculoskeletal type complaints. And the thing that I wanted to discuss first with you is an overlying concept about all of these musculoskeletal problems that I want you to understand first. So anytime we start to look at solutions for musculoskeletal problems, this is sort of the overlying concept that we start with in our mind, is that your body, your structure is a mechanical object. Now, just like any mechanical object, if a machine is running out of balance, if the gears aren't balanced, if the machine is not running like it was designed to run, it's going to break down and wear out early. So in other words, if the gears on your transmission aren't hitting exactly the way they were supposed to, they're going to wear out early. If the tires on your car are the slightest bit out of alignment, as they turn, they're going to wear out before their time. You know, at your house, if you've ever seen a house, you know, where the door is striking the door jamb just a little bit at the top, it's going to wear a bare spot on the door jamb and the paint's going to wear out. It's going to wear out early. Any mechanical object that's not balanced the way that it was designed is going to break down before its time. So your body is a mechanical, physical object. If it's not functioning and balanced and working and bending and flexing the way that it's supposed to, it's going to break down before its time. And it's just that simple. So that leaves us with two goals whenever we start to evaluate these complex musculoskeletal problems that no one else is talking about. And whatever is out of balance, getting that back in balance is number one. And to stop or reverse the damage that was caused by it being out of balance in the first place. So we have to restore balance and we have to repair damage that was caused by it being out of balance. And this overlying concept really applies to every body complaint, every joint problem, every muscle problem, every nerve problem, and disc problem. So if your treatment that you're going through with your body is not designed to do those two things, to restore normal function, and then to stop the damage or to reverse the damage from that lack of function, it's probably not going to be very effective in the long term. Current treatments are all about covering up, patching up, ignoring, generally not fixing problems with the function and the structure. And those programs are not going to work long term. And in fact, they're actually doing more harm than good because they're allowing you to ignore the underlying problem. So it's not that just that Advil is helping you it cover up your pain. It's actually allowing you to ignore your problem. So it's making it worse. Now, here's the second big thing that I see when patients deal with these musculoskeletal problems from a traditional medical perspective. Most doctors fail to realize that one part is connected to the other part, and what happens in one area of your body affects the other. So I'll give you an example of what I mean by that. In their line of thinking, if a patient has a bad knee, you have a bad knee in room 1, you have maybe a foot problem in room 2, you have a lower back case in room 3, not realizing that the entire lower half of the body functions like one system, not three. A rotation in the pelvis will put pressure on the knees, causing knee pain. A collapsed arch in the foot will put pressure on the lower back, causing a lower back problem. The knees cause problems in the feet, and so on. And so you have to evaluate the body globally. As one normal functioning mechanical object, you have to look at the person as a whole, complete, functioning human being. Then you can begin to determine why these problems are happening with the body. Now, the other thing that I notice is that the testing they do for musculoskeletal problems is really lacking. Many times they completely fail to look at functional problems. What do I mean by functional? What I mean by that is how your body is working. What is bending? What is flexing? Is it functioning and turning and working the way that it was supposed to? And like I was saying earlier, the body has to function correctly to be healthy. I'll give you a perfect example of what I'm saying. Take an MRI. Everybody thinks, and Brandon, we still hear this a lot of times, everybody thinks that musculoskeletal problems, like that the MRI is the number one answer. Patients will come in and they'll be like, I went to my orthopedic surgeon and he did an MRI and blah, 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 blah showed up. Like that's whatever that MRI showed was the final answer. First of all, the research is finding now that disc problems and complicated spinal problems, MRIs aren't the end-all, be-all that we once thought it was. Yes, they show soft tissue, and that line of thinking, like the MRI is the grand final answer, that's about 10 to 15 years behind. Most current treatments run about 15 to 20 years behind the latest research. Think about this. When they come up with something new, they really have to test it for decades before it becomes part of standard practice. But all of the current research is showing that body complaints, musculoskeletal problems, is way more important about function than it is just about what the structure shows. So here's what I mean by that. If you've ever had an MRI, the first thing they tell you is to lay down and don't move. So they want you to lay down still on your back or whatever and not move while they do this MRI on you. So here's the problem that I have with that. Your body is designed to have two forces put on it, gravity and motion, meaning that you're standing upright, gravity bearing, and the second thing you're doing is you're moving around, flexing and extending and bending. So why take someone that has a spinal problem or a structural problem when they're up walking around and have them lay down and not move to try to determine what's wrong with them? To me, that doesn't make a lot of sense. Yes, MRIs show soft tissue. Yeah, it's really good at organ complaints, but what we do is we do this amazing new radiology protocol called upright bending or functional x-rays. So in other words, what we would do is we'd have you stand gravity bearing and flex and bend and move the body part as we evaluate it. And you know what? It shows us something that nothing else will. It shows us function. And all the new research is showing that if you can restore function, the body will be able to heal itself. So the secret to healing musculoskeletal problems, again, is, can I restore function? And can I heal the damage that's been caused from the lack of function that's been ignored? And if we can do those two things, the body has no choice but to heal. And I'm going to tell you how we do that right after this next break, but you can see that we're now getting down to the underlying question of why. All of our treatment processes and evaluation processes that we do, we continue to ask this question of why until we boil it down to its finest point. So in other words, a patient comes in and says, well, I have a lot of stiffness. Well, why? Well, because my back hurts. Why? Oh, well, because I have a disc that's ruptured. Well, why? And they go, I'm not sure. That's where the answer really lies. We keep asking this question of why until we get to that finite question of why did this actually occur in the first place? So that's the secret. So right after the break, we're going to go through some tremendous advances of exactly how we do that, how we get these musculoskeletal problems to heal, how do we repair the damage, and how do we restore the function. So as you can see, though, a lot of times we're not asking the right questions. So asking the right questions from the beginning whenever you're dealing with these complex musculoskeletal problems is very, very important. You're listening to Get Well Acadiana with Dr. Kevin. I'm the Senior Vice President of the Bryant Wellness Institutes, Louisiana's most advanced functional medicine institutes. And if you'd like me to call you to discuss your health conditions, I'd happily give you a call whenever I get back into my office Monday. So all you have to do is just call my office right now, leave your name and number on my voicemail, and when I get into the office Monday, I'll call and talk to you about your problems. I can probably let you know over the phone if it's something that would be worth your time coming in to sit down with me to see if we can help you. And so call my office right now at 837-7174 and leave your name and number on the machine, and I'll call you Monday as soon as I get to the office. It's 837 7174. And if you're in the New Iberia area, you can call them over at our other office over there too at 367-2567. Or, you can join us on Facebook, and all of our numbers and addresses and everything's on there. It's Bright Wellness Institutes. We have some mind-blowing new technology when we get back from this break, so stay tuned. Welcome back to Get Well Acadiana with Dr. Kevin. I'm the Senior Vice President for the Bright Wellness Institutes, and today we've been discussing musculoskeletal problems, meaning body complaints like muscles, joints, discs, tendons, back pain, headaches, knee pain, foot pain, all that, ruptured herniation discs. All that makes a big difference to the quality of your life and how healthy you're going to be in the future. So all of the new research that everyone is doing all shows that musculoskeletal complaints are going towards, like the solutions are going towards restoring function. And in our last segment, we talked about that restoring function, if you can restore function and repair the damage that the lack of function has caused, now you're starting to get somewhere with healing and solving some of these complex joint and tissue problems. If you can get the tissue to heal, any scar tissue or any injuries, if you can get that tissue to heal, you can really make strides towards someone feeling much, much better. Now, the neat thing about restoring function is not only does it stop your pain, but you also could get your flexibility back, your muscle tone comes back, you sleep better, you feel better, your body's not deteriorating. And that's way better than just patching up your pain or just having some surgery, fusing a disc or something like that. Now, speaking of fusions of discs, we have a whole program that we try to prevent these disc surgeries. Spinal conditions are the number one disabling thing in America in people over 45 years old. And the reason why is because we don't take very, very good care of our spines. Everybody doesn't take care of their teeth. Everybody has a dentist. If you ask somebody, hey, who takes care of your body and your spine and your structure, they look at you like you're from Mars. And so we have also, though, a great program for post-surgical cases. So don't think, oh, well, I have a spinal surgery, there's just no hope for me. That is not true any longer. Now, the first thing that I wanted to talk about, the underlying problem that almost every musculoskeletal condition has in common. So I don't care what your condition is. I don't care if it's joint pain, muscle spasm, whiplash, disc problems, all of that. There's an underlying condition that if we just treat this underlying problem, it will handle the vast majority of all musculoskeletal complaints. I don't care if it's fibromyalgia or arthritis or disc problems. This is a huge secret to handling body complaints, and that is something called fibrous adhesions. Now, that one condition, fibrous adhesions, are critical that you understand what that means. So if you look at your soft tissue, which when I say soft tissue, I mean muscles, tendons, joints, cartilage, disc, all that. If you look at your soft tissue under a microscope, if you look at it really, really close under a microscope, there's going to be collagen fibers. Your soft tissue is made up of something called collagen fibers, and they're lined up like an interstate highway, meaning if you look at them under a microscope, they're all going to be lined up parallel with each other, nice and lined up to where they can slide and move and bend and be healthy and function the way they were supposed to. That's what healthy tissue looks like under a microscope. Now, throughout our life, we get small injuries, not bad enough that you realize something was wrong, but little small repetitive motion injuries, stepping off the curb too hard and just like tweaking your hip a little bit, or lifting the groceries out of the car just a little bit wrong and making your back sore for a few days, or maybe you torqued your knee at the softball game and it just bothers you for a few days, or something just happened to where you didn't think it was a big problem at the time, but it was just a little small injury. It could even be something like sitting at a desk for 8 hours a day, with a computer screen 2 feet from your face for 15 years. And all of these little things create little micro tears in these collagen fibers. Now, remember, they're lined up like a highway. They're lined up like the interstate here. Now, once you get this little small tear in those collagen fibers, it might be sore for a day or two, and then it gets better, so you really don't think anything about it. But these little small tears, they get repaired. And if you look at that repair under a microscope, the collagen fibers are no longer lined up normal. If you look at them under a microscope, it's going to look more like a fishnet now. These collagen fibers are going to create this patchwork of crisscrossed fibers. And if you feel this under your skin, it's going to feel like a knot or a marble or like this tough tissue, kind of like this gristly tissue underneath your skin. These are called fibrous adhesions, and they are full of pain fibers. They restrict normal ranges of motion. They cause chronic, widespread pain in several different areas. And the more you have of these, the more difficulty you're going to have getting relief. Typically, say like someone with fibromyalgia, they're full of these fibrous adhesions, and they'll have multiple. And the problem is they're so tender, these fibrous adhesions can't be touched or worked on very easily. And especially someone with some of these really inflammatory problems like fibromyalgia, this boils down to how do you reduce the fibrous adhesions in order to get this patient to go into healing. So the thing is, you can't be in this kind of emergency crisis mode and be in healing mode at the same time. So if your tissues are being damaged and in repair and in crisis mode, or if you're sitting at a desk 8 hours a day, your body is doing all it can just to deal with that. And it can't deal with that and be in healing, soft, healthy tissue mode at the same time. So disc ruptures and herniations, knee problems, all of that boils down to fibrous adhesion. Carpal tunnel syndrome, another great example. That boils down to just fibrous adhesion type problems. Sciatica, the same thing. So many of these musculoskeletal type pain syndromes are the person has fibrous adhesions that nobody has addressed. So one of the things about our post-spinal surgery program, it's around those incisions and around those where they removed muscles and tied them back together. All of that creates tons of fibrous adhesions and scar tissue. Now, we have a really cool way that we deal with fibrous adhesions with a new technology we have called rapid release. So the best way I can explain the rapid release technology, it's a machine. It's a little handheld machine. And if you can imagine, if I had a wine glass sitting in front of Brandon, we have a speaker here on the table. If I had a wine glass sitting in front of that speaker, and if I could play a note loud enough, we've all seen the commercial where the wine glass breaks. Okay, but it only breaks if I match the note that glass vibrates at. You see, if I'm one note too high or one note too low, and it's not the same frequency that wine glass vibrates, it won't break no matter how loud, right?
Yeah.
Okay, so the rapid release, they figured out the frequency at which your scar tissue vibrates, at which the frequency at which we can break up these fibrous adhesions. And so the rapid release vibrates at the same frequency that causes this scar tissue to break apart and reduce itself. And if I were to look at it under a microscope, you're going to see that fishnet crisscrossed pain fibers are now starting to break apart and starting to line up into healthier fibers again. And there's nothing better at reducing these fibrous adhesions and scar tissue than this rapid release technology. Now, here's the other cool part about this. Previously, the only way we could reduce these fibrous adhesions is to manual friction treatment, meaning we're taking our thumb, some of you guys may have had this done, and we're pressing on these fibrous adhesions and massaging them and pressing and working them out. Very, very painful to do. And the other problem with that is that when you press, you're actually damaging the healthy tissue around it because you're putting so much pressure on it. Now, with rapid release technology, we can only target the fibrous adhesions, and it leaves the healthy tissue around it completely alone. Anybody that's had failed surgeries or has scar tissue, has fibrous adhesions, or lack of range of motion, any soft tissue injury, this rapid release technology is really a neat thing that we have. Now, the second technology, real quickly, that I wanted to talk about, a new therapy called cold laser therapy. So they've now figured out a way that they can tune a laser beam that whenever it hits your soft tissues, it will stimulate those tissues to heal faster. So as we pass this cold laser over your tissue, it promotes it to heal several times faster, than this tissue would heal normally. This works even great for like diabetic wounds that won't heal on feet and legs, and it works great for things like disc problems and carpal tunnel and other soft tissue injuries, and it allows them to heal much faster than it normally would. Now, this laser does not heat up. When people hear laser, they think this thing's going to burn me. It's called cold laser because it's not the same frequency of like you think of like tattoo removal where it burns, or these lasers that you go to the cosmetic place and get on your face. It's below that. It's warm, but it does not burn you. And professional athletes all over the world are using this technology. We use it a lot on Olympic athletes. It's a really great way to reduce pain and stimulate healing to these soft tissue areas. Now, the next one I wanted to go over real quickly before our break is this is especially good for disc problems, and disc problems are such a common musculoskeletal thing, is decompression. Decompression is a really great treatment program for that. The best way that I can explain decompression real quickly is basically you put the disc under a vacuum and it sucks the disc material back into where it belongs. Think of like an airplane. Everybody knows in an airplane, if you break the window, everything flies out. That's because there's a negative pressure. Everything wants to push out. If you reverse that, and if you put a negative pressure on the inside of the airplane, everything outside would go suck in the window. That's basically the way disc decompression works for your disc. We put the disc under a negative pressure, and the disc material is sucked back into the disc so that it can stop bulging out and pressing on a nerve. Now, here's the neat thing about this. Research shows that if you can get it to suck back in where it belongs, the body will form a patchwork of tissue over that previous bulge, and it's actually going to be stronger than the rest of the disc around it, and it will never bulge again in that area. So now, one word of caution, you may have tried decompression before without very good results, and it's likely that technique could have made a difference, but the way that it was applied may not have been the best. So we're certified at disc decompression therapy. I've seen people put on the machines wrong. I've seen the settings wrong. I've seen people put upside down on the machines, believe it or not. But so the technique and the way that you apply this is very, very important. So when we get back from break, we have another amazing new treatment option out there for people with these musculoskeletal problems. And remember, if each one of these things helps you 25%, then guess what? We're 100% of the way there. So give me a call and let's see if these new methods could be right for you. So if you want me to give you a call Monday, just call my office at 837-7174 and I'll give you a call back Monday whenever I get to the office. It's 837-7174 and I'll personally call you. It won't be my staff, it'll be me. I'll have a phone conversation with you to see if my methods might be right for you. So we have a really good one after the break, so stay tuned. It's 837-7174. Welcome back to Get Well Acadiana with Dr. Kevin. So the last topic that I wanted to discuss, so what we've been going through previously on the show today is musculoskeletal complaints, and we're talking about some advancements in natural solutions for today's most complicated musculoskeletal problems. Now, the last topic that I wanted to discuss today, because I'm running out of time, real quickly, is dry needling. Some of you may have heard of this, but some of you may not heard of dry needling before. So now I realize if you ask somebody, hey, do you want to be dry needled? That doesn't sound too appealing. But here's what that means. Let me explain what dry needling does. Anytime an area of your body goes into pain, the body's reflex is to splint, meaning that it's going to contract all the muscles and tissues around that painful spot. You guys know that. When something hurts, it's going to spasm up around it. Now, that's a reflex. You can't stop that from happening. Here's the problem. When you have a painful area, your body's response is to spasm and reflex around it, to flex around it. Now, here's the problem with that. When that area of the body goes into spasm, it pushes the blood supply and blood flow out of the area because the spasm is too tight to get enough blood supply there. Now, the blood supply is what contains all the oxygen and the healing chemicals that it needs to heal that area. And the blood supply also washes out all the waste products out of that area, like lactic acid buildup. So you get this exchange normally of tissue, of oxygen, nutrition in, and waste products out. Now, when the area of the body splints or tightens around this pain, it pushes the blood supply out, And that robs that painful area of enough oxygen and healing chemicals it needs to feel better. So it gets more painful. So it pushes more blood out. So it gets more painful. It gets less oxygen. So you can see you end up with this downward spiral of what turns into chronic pain. So the tighter and more painful it gets, basically the tighter and more painful it gets, meaning it's just not going to heal. It's stuck. It's stuck in chronic pain. So the question becomes, how do we break that cycle? How do we shock the body out of this vicious downward spiral? Well, when I take a tiny acupuncture needle and I start to insert it into that painful area of the body instantly physiologically changes its response. And it starts to rush more blood flow to the area, and it instantly relaxes the spasm. It flushes out all of that waste products out of that chronic area. So you get this exchange of healthy oxygen and nutrition to the painful area, and let's wash the waste products out of those tissues. So at the cellular level, it actually promotes healing. It brings oxygen and nutrition to these painful areas. So now just imagine that if we did all four of these things I've talked about today as part of a comprehensive wellness strategy, if each one of them just helps you 25%, we're all the way there. If 3 out of 4 of them help you, we're 75% of the way there. So now we're getting somewhere. We're starting to make real strides in finally solving some of today's most complex and difficult chronic pain and musculoskeletal complaints. And with the opiate epidemic like it is, and with everyone out there suffering with these musculoskeletal type things, this is not something that you want to take lightly. This is a life-changing thing that we're talking about. So thank you for listening to the show today. I really appreciate all of the emails that I get. You can email me. You can join me on Facebook. You can private message me there. But if you're interested to see if some of these advanced technologies might be able to solve your problems, why don't you give us a call? And when I get back to the office Monday, I will call you back and have a phone conversation with you to see if this method might be able to help you. And if it is, it might be worth a consultation where I invite you in to come and sit down with me, and then I'll be able to tell you for sure. Obviously, I can't tell you for sure on the phone, but at least it's worth a conversation with us to see if I think it's worth your time to come in and sit down with me. So my office number is 837-7174. That's 837-7174. You should give us a chance to look at you. I don't care how complicated you think it is. I don't care how difficult your problem is or how many times you've been told nothing can be done. Don't take that as the final answer. This is your life that we're talking about. Now, if you're in the New Iberia area and you want to talk to Dr. Fontenot about this, his number is 367-2567. And also, I wanted to invite all you guys. I have a Facebook show that I do live, Facebook Live. It's called Dr. Kevin Live and Online. I do Thursdays at noon. So go like our Facebook page at the Bright Wellness Institutes. I'm posting some really neat information, usually every few days on there about some of this advanced technologies and some of this research. So listen, take care of your health. It's the only one you'll ever have. Thank you for listening to the show today. My number again is 837-7174. This has been Get Well Acadiana. See you guys next week.